father of a country said, one point in time that, if you want to serve and you want to know the real India, it is in, villages. So, really happy from the bottom of my heart and from TATA Communications, to serve and probably, ensure, because IT, as I see, is a great enabler, which can actually, you have a X, if you want to make it 10X, 100X, that's where an IT is, and you have a standard processes, we can take that standard processes to multiple X, that is how IT helps you, so very happy. As you have seen here, TATA Communications is a big brand, definitely. But at the same time, we want to associate and do the real meaningful work at grassroots level. And that is where the genesis of a Gloheal is there. And as far as my experience goes, I work across industries, primarily from pharma to healthcare IT. So when I understood, the kind of work that Dr. Raja and team is doing, really happy. I recently joined Tata. So this is first impression that I have. As far as our solutions are concerned, we have three kind of solutions in our portfolio. So as I see healthcare, there is a primary care, secondary care and tertiary care. So when it comes to primary care, we have a solution from VCMP portfolio, which are actually, having patients who is in either the homes or in the ambulances or in the hospital. So we ensure that they get tracked, they get treated. So that is there is a backbone of a technology which comes from the three kind of subsets. One is a hardware, that is an IT hardware, and hardware can be even the telemetric devices that we integrate in our solutions. And when it comes to software application, there are different variants of an application which can be web-based, which can be mobility solutions. And also we have a telecommunication, which is a backbone for all the data to be transpired from one end to another end. So there are solutions which come from VCMP. Then, like Dr. Raja said, another is HIS, Hospital Information System Solutions. So that also we have from our portfolio. And definitely for some of the hospitals, from the imaging perspective, we have solutions which is a PACS integrated or VNA integrated kind of solutions that we have. So when it comes to digital transformation, as I see, I'll give you a few examples that will actually help you understand what actually we do and how we see the world moving forward. So one of the example that I want to say is that initially when we started, there was no IT, so everyone was looking at a tertiary care hospitals, so but when it comes to now, in startup ecosystem, last 3 years I have been nurturing few of the startups in the healthcare IT. So those people who are in the North America, now they say that, come to India, there is a huge potential, So now, rather than looking at a tertiary care setups, look at primary care is my honest observation. Each one should do, because that is where the problem is, we already suffered in COVID. So now everyone wants to become a preventive care. Everyone wants to do something which will stop us from moving to tertiary care settings. So that is where, there are a lot of solutions. So a few of the problem statements which I encountered while working in few of the large hospitals in India, especially in Maharashtra, Kerala, where I managed end-to-end product portfolio solutions, delivery standpoint. So patient waiting time in a tertiary care setting, that can be reduced, So that there is a solution, like a queue management solution. So that is one of the solutions that we can deploy in the hospitals like you. Then when it comes to patient coming to the hospital settings, there can be a curated patient education material that can be delivered to your mobile solution of a patient. So that is also one of ways. So that will give you more engagement with the patient. So there are a lot of solutions that we can build and offer to you at a cost-effective manner, because that is what Gloheal stands for. So we'll deliver at the cost-effective manner. That is the kind of a foundation that we have. When it comes to even the operational excellence, we will give you analytics-based understanding in terms of what is the that hospitals bed occupancy, what is the seasonality change. So all that is coming from the big data or analytics that we will try to offer from the data that you have. So we have solutions across all this portfolio, So that is where the IT can be of a great help to you in terms of even the cost optimization, better patient care, and obviously, being a backbone of a technology, there is a data which can be transmitted from one end, and it is across all the, in your homes, in your ambulances, in the hospital settings, and even connectivity to tertiary care settings. So that is where actually I see a great potential of a technology, and it is an enabler in my opinion. So that is the Tata Communications can do for Dr. Raja sirs and your hospitals.